So
Yeah.
I had been experiencing GI symptoms for a while and I didn't really do anything about it. I kind of just like dealt with it and carried on with my life. As a GI dietitian, I see a lot of patients with SIBO, and so I didn't really see those typical signs in myself. Like a big red flag for SIBO is like the constant bloating that kind of increases throughout the day and abdominal pain with that. And I wasn't experiencing that. So it kind of took me a while to take action on my GI symptoms, but I think finally just being like, okay, like I am a GI dietitian. I know this isn't normal. I should be doing something about this. And just heads up on anyone who's watching, we might get a little bit into the details a little. It might feel a little bit TMI, but I feel like it's very helpful to share. But for myself, my major GI symptoms were diarrhea and loose stool, and I was experiencing that like every day.
Yeah.
And like thinking back, like, yeah, it was pretty bad maybe the past like 6 months, but really, I think I've been dealing with this like on and off for like 3 years. And I'm like, oh my gosh, like I can't believe it took me so long to do something about it. But the biggest red flag that really got me to like get into the doctor and like try to get a GI referral was that I was having diarrhea every single day and it was like orangey in color. So like to me, that signals maybe some sort of fat malabsorption or something is wrong there. So that was it. And then for me too, like I had been dealing with low energy, fatigue, and brain fog for a very long time. And I think like it's very hard to pinpoint what is causing that. Like I also have POTS, so I was like, maybe that's part of the picture. I have had COVID a couple times. Is this something to do with long COVID? But then, also GI things like SIBO can also have overlapping symptoms like fatigue and brain fog. So I brought all of those up with my doctor. And honestly, like in terms of my quality of life, like I said, like these symptoms weren't crazy. I mean, they're not good, but I wasn't dealing with that crazy abdominal pain and bloating. And I think like it wasn't affecting me too badly in the beginning. I think that's why it took me so long to finally do something about it. But I know that you also have had a totally different experience, and I'd love to like just talk about that and compare our experiences because I think it's really helpful to see how differently certain GI conditions present in different people and that everyone's story is different and everyone's even like treatment story and like kind of that recovery period is different too. So, what was it like for you kind of that before your SIBO diagnosis experience?
Well, I feel like I come from like the olden days where I feel like they didn't even know there were multiple types of SIBO. It was like, for me, it was about 6 years ago when I started experiencing my SIBO symptoms. I was still in college. Trigger warning, because I will discuss some things around eating disorders and disordered eating. But I was through high school and college having on and off like an eating disorder and having a lot of different behaviors, not eating frequently throughout the day. I had been vegan at the time, cutting out lots of major food groups. So for me, it presented like extreme bloating, kind of how we kind of look clinically at SIBO. I had that 6-month pregnancy kind of bloat pretty much after every meal. Then within 15 minutes, I was really starting to feel that bloating, brain fog, fatigue, kind of nausea, a lot of nausea, dizziness. So it was kind of hard for me to see, what was happening there. And it was like multiple ER visits, me going to the ER, trying to get checked out. I was young, very young at the time.
Yeah.
I think for a lot of individuals who are on the younger side, sometimes their symptoms are kind of written off as anxiety, or through our menstrual cycles as women too. That was also something that was said to me with multiple ER visits and kind of going to different doctors. So definitely took some time. And I physically remember like my kind of turning point to really start looking into things was I went on vacation and accidentally had a whole clove of garlic at dinner. Didn't realize it at the time, and by the time I got back to my hotel room, I was like on the floor just crying
Oh
in
my
pain
God.
and bloating. So that was like, okay, I need to wake up and do that.
So it sounds like your symptoms really did affect your quality of life and that really like pushed you to finally like look into care. And do you feel like it took a while to get your SIBO diagnosis? Because you mentioned like having to visit the ER and like other things that were going on in your life at that time.
Yeah, it took a while, and I feel like that's so different for every person. Either it's kind of like we're holding ourselves back, being like, "Oh no, I can handle it," or it's, just unfortunately not getting the right kind of help from the provider side. So, my PCP, it took a while to get a GI referral, and then it took a long time to have a GI really take my symptoms seriously. We did an endoscopy,
Yeah.
and nothing came back from that. And then I just happened to have seen a video online of, another girl who had SIBO and was kind of describing her symptoms and her journey. And that's why this stuff is so important as well. But I
Yeah.
saw that and, brought actually some articles to my doctor. Like I came in like ready to go and took about 2 or 3 appointments to convince my GI doctor that like we were going to do breath testing, and at that time SIBO was even less known. So I understand the hesitation there, but it definitely can take some time.
So it sounded like you really like advocated for yourself. You're like, hey, I saw this. It sounds like it might be what I'm dealing with. Like, let me bring some kind of evidence and argue this with my doctor.
Yeah.
And this was before you were in the nutrition world, right? Like this whole experience, you weren't even studying to become a dietitian at the time.
Yeah, so that's like the fun thing too is it's like we're looking at this from like the RD side and then like the patient side. And at the
Yeah.
time, I was high stress, working a lot, very type A, really getting a lot done. So coming to my doctor at the point, I was not interested in nutrition, dietetics at all, but just really confused. And I always like to joke I've done every protocol and diet under the sun. So
Yeah.
we understand
Which we
where.
will dive into. I want to hear about that too.
Yes, but I feel like we understand now being dietitians, we understand now from so many sides personally and then just from the clinical side, understanding looking for answers is a really
Yeah.
big part of kind of this whole journey.
Yeah, and I think my experience is definitely different than yours because you said, like you mentioned, like this happened a while ago for you. You were quite young. It was before SIBO had really been recognized or like acknowledged a lot in like the medical community. And for me, I was a GI dietitian before this happened. And so I think like just having my own knowledge and being like, okay, I mean, maybe I didn't act on it as soon as I should have, but like being like, okay, something's wrong here. Like, let me investigate this. And it was, it's that in itself was a very interesting kind of shift from being like provider to patient for
Yeah.
me. And then also like when I brought this up to my doctor, I feel like I was very fortunate in that I got a diagnosis pretty quickly, like had to go through quite a bit of testing. And I got some questions on my Instagram page about like what that experience was like with my doctors, what tests were run. For me, I recently moved to Brooklyn, so I'm establishing new care. And the first time that
Mhm.
I saw my PCP, I was like, hey, also FYI, this like weird thing's happening with
Yeah.
my bowel movements. And she was like, I don't know too much about that. Let's send you to a GI. And I'm also very fortunate to be living in New York City where I do have a lot of options for providers. And so I kind of chose a young woman doctor that I actually was familiar with the practice that I felt comfortable with. So that in itself was very a great privilege of mine to have. But that GI doctor was very validating, like was so ready to investigate. I got all the blood work done. I got colonoscopy, endoscopy, which was a crazy
So fun.
experience. Yeah, we
So
ruled
fun.
out celiac. We ruled out, inflammatory bowel disease. Ruled out any sort of pancreatic insufficiency, and kind of started with that. Did you also do those? You mentioned the endoscopy. Did you also have to like rule out those other conditions before doing the breath test?
I don't think I think this shows how much we've evolved, as a profession because I love that the experience was like, okay, we're going to talk through this, we're going to get this testing done. They took you very seriously. And that gives me a lot of hope, as a provider
Mhm.
and as patient of like, okay, this is where we are now and really seeing our patients, their concerns being taken seriously and, and kind of their quality of life changing. So
Yeah.
for me, it was a little different. Endoscopy happened. I don't remember much conversation around. I'm sure they, of course, in the endoscopy checked for celiac, H. pylori, all the different things. But it kind of, I came out of the endoscopy and they told me I was fine and handed me the low FODMAP diet handout, the dreaded low
Yeah.
FODMAP diet handout.
Yes.
We're like, stay on this until you feel better.
Hmm.
That's not a thing, just so we can clarify. It's not a thing that we stay on it till we feel better, but I did have to push for the SIBO test after that. I didn't want to
Yeah.
something without knowing answers. And so pushing for the SIBO test, I remember it came back immediately positive for me for hydrogen dominant SIBO. And
Yep.
even with the results, they still didn't really quite believe that it was SIBO. But I know we'll get into also treatment and everything like that. But it was, to preface, it was a lot of rounds of antibiotics. So I'm really, really happy that we've evolved as a profession and have like more of a streamlined approach now with SIBO.
Yeah. And did you make any changes? I mean, even before, maybe even before you saw a GI doctor, like you were noticing this bloating, noticing this pain. Like, did you try anything on your own? I know you were having a kind of a restrictive diet at the time. Did you change anything there?
Oh yeah, it got worse. Yeah.
Yeah, more restrictive.
Yes. So at the time
Mm,
I was vegan, practicing a plant-based lifestyle, which I really liked at the time. And it kind of got ramped up at that point. You're searching on Dr. Google, and I was practically at fruitarian raw vegan at that point. So sugar was out, oil was out, and it was definitely more restrictive than ever. I was really into Team Celery Juice. It was Celery Juice City all the time, you know.
hmm
So it was really now kind of looking back, quite a lot of high FODMAP foods that I was really incorporating at the time, which didn't
Yeah.
feel better,
I was gonna say, did your symptoms get worse as you
Yeah.
got more restrictive?
Yes,
Yeah.
definitely got worse, and then you're kind of searching for more answers, and you're always looking for that next thing. So we really understand where our clients are coming from, is they're just trying to feel better. But
Yeah.
yes, and then once low FODMAP, and the big thing I always like to say, if any provider is watching, is please screen your patients before you give them the low FODMAP diet.
Yes, especially maybe like where you were coming from at that time, like if that felt appropriate to you looking back now as a dietitian.
Yes, like now looking back, it was in my chart that I had kind of started coming to the realization that I had a disordered relationship with food. I was showing signs of kind of not eating enough throughout the day, having a very restrictive lifestyle. So I caution any single provider who's kind of listening right now, please screen your patients before restrictive diets like the low FODMAP diet. And of course, we're going to say a couple times is refer them to a GI dietitian. So much time and energy, and feel so much better, so much quicker with them. But, with your experience, how was it after you got your diagnosis? Is that kind of something like what was the next steps for you after that?
Yes. So I think that something that I really struggled with internally for myself was like, I knew something was wrong with my body. I knew something was off. And we did the blood work. We did the stool sample. We did the endoscopy, colonoscopy, which was miserable for me. Like I don't do well on a liquid diet.
No.
I'm terrified of needles, like the IV, like all
Yeah.
of that is just very traumatic for me. Like it was not fun.
Yeah.
And after all of these tests, which makes me like empathize with my patients 10 times more, but after all of these tests coming back normal, it was almost like more frustrating. Like I was like, okay, I'm so, so thankful that I'm healthy and I don't have like celiac or IBD, any of that. But it was like, okay, everything's normal, but like clearly it's not normal. And it's just like more frustration and like just feeling like, okay, like what else can we do? And thankfully, like I mentioned, my GI doctor was very much like, okay, like we're not going to stop there. Let's keep digging. She was familiar with SIBO, like,
Right.
and that was kind of our next step. So did the SIBO breath test. I did have to wait a while. I think it was like a month after getting a colonoscopy. You have to wait to
Yeah.
like kind of let your gut microbiome kind of go back to where it was or like any other changes there. And then did the breath test. I came back positive for hydrogen and methane, which is very interesting because the methane is more common with like constipation. And I am, as far as I know, I am not constipated. Like that is the opposite of my issue. So it's really interesting. Like
Yeah.
we'll get into the treatment in the next video, but in a way, it was kind of a relief to just have some clarity around like what's going on in my body. Like as a dietitian, I was like, oh, it's so weird. Like I never would have thought that because I wasn't experiencing that bloating and like abdominal pain, but it just kind of went to show me even more like it's not always textbook, like the presentation of what you're dealing with. Like everyone kind of has a unique experience, and it just gave a little bit more clarity. We have seen issues with like fat malabsorption with people who have SIBO, so maybe that's why my poop is orange. Like
Yeah.
that's maybe what's going on there, or even just like the fast transit. Like there could be something going on with my GI motility there. So it was in a way kind of comforting and then shocking. Like I was
Yeah.
like, like I said, I went into this field just because I'm interested in digestion. I'm interested in the gut microbiome, and I've learned so much about IBS and SIBO just from my like clients and from training. But then I was like, wait, am I my own patient now? Like what is happening here? And I mean, as you remember, I like immediately reached out to you. It was
Yeah.
like, you will never guess what just happened. Like this is crazy. So I've been kind of chatting with Jacquelyn even about this and like kind of getting some support through that as well.
When I got Emily's text, I like was in the middle of shopping, and I like couldn't believe that that's what we were kind of dealing with at the time, because it
Yeah.
was so different. And it really was like a nice experience for both of us to realize, okay, it's not always what we're taught, in school with like exactly the clinical criteria. And, sometimes it's looking outside the box and seeing that, maybe this one symptom really is the predominant SIBO symptom. So
Which is so interesting because like you had your own SIBO experience. So like probably comparing what I was telling you to like what you had experienced, you're like, wait,
yeah.
this is so different.
Yeah, no, and it shows the complexity of GI disorders
Yeah.
and conditions. They are never really the same for every single person, which is why this field is so much fun. And come hang out with us online because we love talking about this. It's
This
so
is
much
what we talk about all
literally
the time.
together. This is how it is also when we're not on camera. This is exactly how it
Very
is.
true.
But when it comes with my SIBO diagnosis, it was really validating. It was kind of I do remember I was younger, so I was kind of sitting in the doctor's office and I was like, I was right and my doctor was wrong.
Yeah.
And they definitely did not want to talk about that. So it definitely was validating, and it really helped me to kind of put a label on it. But it was another 3 years of kind of dealing with my SIBO symptoms, even after the diagnosis. And I know we'll kind
Yeah.
of get into that as well. But it was definitely not a scenario where it was like, okay, I got my SIBO diagnosis, I got my treatment, and I was better. It
Yeah.
definitely more of like I say it's like an up and down kind of healing experience versus kind of steady with a lot of our
Yeah.
clients too.
Which will be really interesting for us to talk about next because I've had a very recent SIBO treatment and you've had it quite a few years ago. So kind of see like maybe compare some of our experiences and see where we are in our healing journey. So we'll be sharing a bit about our treatment in our next video and a little bit more about living life after SIBO treatment and the video after that.